We're going to turn to another developing story now, dental care. Just about a month after the government opened up applications for the new program, which is for people with a family net income less than $90,000 and who don't have private insurance, the feds today announced that more than 400,000 Canadian seniors have already so far signed up. When will the government deliver actual coverage to those applicants? Mark Holland is the federal health minister. Hi, Minister. Good to see you again. Thanks for coming back on the program.
Thanks for having me, Vashi.
I know that you announced today that 400,000 Canadians have already signed up to the dental care program, and you're only a couple of phases in. How many dentists do you anticipate you're going to need to have signed up to ensure that all 400,000 of those Canadians can access a dentist and participate as soon as the program opens?
Well, our intention is to have all dentists everywhere participate. We've been working with the dental associations, negotiating the details. Those have been very productive conversations. They had a number of different concerns. We've been trying to work through those. We're imminently ready to talk directly with dentists and providers. We've been working very closely as well with Sun Life. Sun Life, who is going to be our provider in this instance, who's very familiar with the space. So we're confident we're going to have really strong uptake, and we're going to see dentists all across the country participating.
What informs that confidence? Can you qualify it or quantify it in any way for Canadians watching? Because I will tell you, on the flip side, there have been so many dentists who have reached out to me in the interim since our last interview, when I asked you about this the first time around when you were announcing the applications were opening, who were saying they have no idea what fees they're going to get, and they have no idea if they're going to be able to include this in their workload.
Yeah, Vashi, you're absolutely right. They don't know, and that's because we've been talking with the provincial and territorial associations about the details so that we can get that right and have a feel and a conversation. And of course, that predated, there was a lot of work that happened even before my tenure as health minister, having conversations to really understand the needs of the industry. And now we're getting ready to move to talk directly to providers over the next couple of months and get them to sign up. We're going to be able to show them exactly what it is. Just a little bit longer, we're going to get there, but we've been very fair. Our objective here is first and foremost to make sure that dental care is available for everyone. We have about 1/3 of Canadians who don't have access to dental care. That has devastating consequences, not only for their confidence and for their ability to have healthy smiles, but also for their health. And so, making sure that as well we're fair to dentists with a program that compensates them fairly. I base it on reason. And the conversations that I've had, I feel very confident that we're going to have something there that's fair to both patients and dentists.
And Minister, I understand the merits of the program. That's why I'm asking you about whether you can execute it. And specifically when you talk about being fair, for example, or giving dentists what they should be entitled to, like, what does that mean? Will the fees be commensurate with what they would get otherwise? Will they be higher in order to incentivize their participation?
Well, I think, I'm going to be able to release that very soon, and I understand that it's frustrating to wait. We want to be respectful of the negotiations that we're having with the dental associations. But what I can say is that dentists right across the country, in many, many instances, frankly, in most instances, have been engaging in pro bono work, helping people who had needs on an ad hoc basis. They've been remarkable in their desire to step up to the plate and to be part of the solution. They're just asking for fair compensation. We're going to make sure that happens. I'm very confident that I'm going to be able, in a very, very short period of time, when I can come and talk about the provider details, to be able to lay out what is very fair to dentists, and at the same time making sure that patients get the services they deliver and delivered in a way that makes it accessible for them. Remember, most of the people, a huge number of the people that are coming forward, will have never had oral health care before. Some of them may never have had medical care before in their life. So getting this right is really important.
It is really important, and I imagine a number of them will be watching tonight wanting to know for sure that now that they've been accepted, they will actually have access to those programs. Why wouldn't you have negotiated what you are negotiating now prior to opening up applications so that you would know exactly what the program can absorb? Were you moved faster because, or quicker to get the announcement out because of political pressure from the NDP, or just to make that announcement? Like, would it have been wise to start at a different spot?
No, I mean, look, the conversations have been very intense for well over a year. But the associations are the ones that we've been negotiating with in the last while to make sure that we get it right and make sure We're not going to agree on everything. They're not going to get everything they want. We're not going to get everything that we want. That's the nature of negotiations. But there's no problem with doing that concurrently. And remember, we have a long time between now and May when services roll out. And I feel deeply confident in the program. Remember that it's also being administered by Sun Life. Sun Life does this for private plans. They're experts in this area. We rely on their expertise as well. So looking at all of those moving pieces, I feel very confident we can meet those timelines. And yes, there is pressure. There are all kinds of people in this country who don't have access to oral health care. That's an issue fundamentally of preventative health. That's an issue of cost, because if they don't get that care, then it's going to become much more expensive. They're going to wind up in emergency rooms. And then most importantly as well, it's also a fundamental issue of affordability. This is a really critical thing that folks need that they can't afford. So it's important that we be able to extend that in what are difficult global times.
Can you tell all those 9 million Canadians tonight that they will be able to access a dentist, though? Like, that's the premise of my question, my previous question. Like, if you knew how many dentists would be signed up, wouldn't you be able to better assure Canadians tonight that they will have access? They're kind of just going to have to trust you.
Well, look, here's what I can say, is that right now there are 9 million Canadians who have no access to oral health care. That is changing as of May. And that it's going to be iterative. We're rolling it out in waves. 9 million people is a huge number of people. It's the largest program in Canadian federal government history. It won't be without bumps. It won't be without challenges. But we can't allow perfection to be the enemy of progress here.
But respectfully, Minister,
person we
sorry to
sign
interrupt,
up,
I'm not
every
asking
person
for
who walks in.
perfection. The people who need dental care need dental care. I'm just wondering if they're all going to get it.
What I'm saying is that we believe in the plan that we have to roll this out cohort by cohort, that people are going to be able to get the services that they need. It's not going to be perfect. There's a lot of barriers, not just in terms of having that card so that you have access. There are people who have geographical distance challenges. They're rural, remote communities, places where people who face systemic racism and discrimination, where they're afraid to enter into a healthcare space. That's why we have the Oral Health Access Fund. Our goal is to make sure we get everybody. Right now, it's 0 of 9 million. In May, every day we're getting better. Every day, more people who need oral health care are going to get oral health care. And that's the objective, to make sure as we move through this that everybody is going to get the care that they need. I lack clairvoyance, so there's going to be some hiccups. There's going to be some problems here or there. But we have an extremely nimble team. We're working with a very experienced provider. We have a very fair and reasonable proposition we're putting to dental care providers. And we have strong support, not only there, but among hygienists and denturists. And so I'm feeling very confident about the success of this program.
Okay, Minister, before I let you go, I did want to ask you, I know that there's legislation on the order paper around the extension of the MAID expansion, and you can't talk about the details of that legislation. But I wanted to ask on principle if, as the federal health minister, you do believe that MAID should be expanded to people with mental illness.
I think I can say because I do have to be careful here. We have legislation, and I'm not allowed, as a result of parliamentary privilege, until that legislation is public, to speak at it. But I can speak at a very high level, and I think at a very high level there is absolutely equivalence between physical suffering and mental suffering. The question here has really been one of readiness. And that's what I've made comments on, and so the legislation will be, I'll be in a position to talk in more detail. At this time, that's really the only answer I can give you because of parliamentary privilege.
Yeah, I checked with 2 constitutional experts because I heard you say that earlier today, and my understanding is you can speak broadly about mental health, for example, just not the details of what's in the legislation. Do you believe it is possible for clinicians to diagnose irremediability in mental illness?
Well, here's what I know. I've talked to physicians, and it's very rare, but there are people who've tried everything, and after decades of suffering are in an absolute nightmarish state. And that, we're going to have to look at that as a country, what we do with it. That's what this debate and the legislation is going to be about. But those situations absolutely exist. And we need to have a conversation as a society. If somebody for decades has been trying to navigate this and are making a decision under their own recognizance of their own free will, that they've tried absolutely everything and that they're living in a nightmare that they want to end, then we have to have that conversation. That's what this legislation's about. Unfortunately, I can't go into any more detail than that.
How do you know if someone has tried everything when the state of access to mental health care in this country is so denigrated? Like it's so inaccessible in so many places, and we have so many studies to show us that. Does that not impart like a difficulty in assessing whether there are no other options?
Well, what I can say, globally, and certainly it's the case in Canada as well, we're facing real challenges with mental health, and we have to do everything that we can to expand mental health services. The agreements that we're signing with every province specifically have mental health elements built into them so that we can lean into that and work with it. How we treat each other, what kind of workplaces we have, what kind of supports we put. This is a whole of society effort that must be placed into mental health. We're in a time where folks are going through really rough things, and frankly, we're not having the kind of generosity and kindness for one another that we need to have. And so it's not just going to be the action of the federal government. It's not going to be just the action of provincial or municipal governments. It's workplaces. It's how all of us treat one another.
Right.
This is a very serious problem.
It is a very serious problem. That's why I'm asking you about it, because even the parcel of money that you sent to the provinces, I mean, in Ontario, I was speaking to the health minister there last night. There's still 28,000 kids on a waiting list for mental health support, for mental health services. Again, why is the discussion focused on providing MAID and not more focused on every possible effort to make sure every possible mental health service is available to the people who need it? The money that you sent provinces, for example, is it tied to metrics? Like, do they have to clear those wait lists to get it?
Look, Vashi, as somebody who has had my own challenges with mental health that I've spoken very publicly about, the idea that we're focused anywhere other than trying to ameliorate that, I think is unfair. That what we are absolutely focused on is coming out of a pandemic, which amplified existing mental health challenges, dealing with a world that is incredibly heavy right now, where people are losing faith some days in the future of humanity. That we have an existential crisis in front of us as a species, and we got to lift each other up, and we're going to have to all lean in, and these solutions aren't easy. And it's easy to say, do more, and but the reality of working collaboratively with provinces is where action is going to be held. And it's not just with talking with provinces and territories; it's workplaces as well, and it's making those critical investments. It's going to be a difficult road. The challenge in front of us is significant as a species everywhere on the planet, but we've got to lift each other up, and we've met other similar great challenges. We will meet this one. And the agreements that we have are an important step in that way. The meetings that we had in Charlottetown with all health ministers pulling in the same direction, saying within our health system and with mental health, we have to stop focusing on our differences and focus on working collaboratively and all pulling in the same direction. There's nobody who has all the answers, and there's no easy answer. But what I do know is playing politics or focusing on our differences won't get us to where we need to go.
Okay, I'm out of time, Minister. I'll leave it there. Thank you for your time this evening.
Thanks so much, Vashi.